Sejahtera. I am Nur Asha Shaira, one of your reporter for today. Let's see our headline for today.
Dan sebaik selesai majlis pelancaran kempen perdana BM 2020, kemeriahan sambutan ambang tahun baru diserikan dengan persembahan 300 drone, kendalian 3 agensi kreatif yang melakukan 11 formasi dengan setiap satunya mempunyai makna tersirat kepada Tahun Melawat Malaysia 2020.
Menurut Datuk Seri Dr. Zulkifli, secara realitinya jangkitan influenza di negara ini belum di peringkat kecemasan. Namun, kementerian sentiasa mempertingkatkan pengawasan terutama di lokasi yang lebih terdedah dengan penyakit itu. Tambahnya, tiada keperluan untuk memasukkan influenza A ke dalam senarai penyakit berjangkit bagi membolehkan cuti kuarantin diberikan setakat ini.
Saluran pernafasan.
Influenza A outbreak situation in Malaysia. Influenza A outbreak declared in Selangor, 22 affected, 3 hospitalized. According to the latest WHO data published in 2020, influenza and pneumonia deaths in Malaysia reached 23,477 of total deaths. The age-adjusted death rate is 90.22 per 1,000 of population rate in Malaysia. The government has declared an influenza A outbreak in Selangor. The Malaysian government has the situation under control. The identified school allocation are being monitored by the government to control any possible spread of influenza A or influenza-like illness (ILI). According to the WHO, annual influenza epidemic worldwide result in an estimate 3 million to 5 million cases of several illness. Accidentally, towards the 8th of December 2019 and early the 2020, Malaysia recorded an increase in influenza A case, with most of those affected being school children. Selangor had recorded the highest number of cases there, with more 800 school children affected. 2 schools in Perak and Sabah had to close temporarily due to an influenza outbreak, which has got many parents worried.
Influenza is a disease caused by the influenza virus that infects the respiratory tract. It can result in minor or major infection system. An infected person may face a life-threatening situation under specific conditions. For countries with temperate climates, outbreaks often occur during the winter, while for tropical countries along the equator, including Malaysia, outbreaks occur throughout the year without following a specific season. In January 2020, Health Director General Tan Sri Dr. Nur Hisham Abdullah said in a statement that lab surveillance by the Institute of Medical Research and the National Public Health Laboratory showed that the consumption rate for influenza-like illness (ILI) and the admission rate of patients with severe acute respiratory infection (SARI) had increased since the last week of December 2019. The number of ILI and SARI cases reported by Malaysia Influenza Surveillance Centre to WHO showed an influenza positive rate of 21.2% in 2019. For the first quarter of 2022, the influenza positive rate was even higher at 32.8%. In comparison, the influenza positive rate was only 10.4% in 2018. 13.3% in 2017 and 8.6% in 2016. Dr. Nur Hisham, however, was quoted as saying that influenza infection in Malaysia were still under control and within the normal range.
How is influenza transmitted? Influenza spread from one infected individual to another through respiratory droplets when talking, coughing, or sneezing. This droplet can contaminate the surface and cause infection to individuals who touch the surface. Who is at high risk of getting influenza? First, children under 5 years old. Second, pregnant women. Third, senior citizens at 65 and above. Fourth, individuals with chronic diseases such as diabetes, high blood pressure, asthma, and others. Lastly, individual obesity and individuals with low immunity such as cancer patient, HIV patient, undergoing chemotherapy, and others. Moreover, how to know if you have influenza is the best person to advise you is someone trained to identify about this. And the doctor near, but only a trained doctor will know how to diagnose this. The Penang Education Department (JPN) has confirmed that the number of students infected with influenza virus in the state is increasing and now reached 103 students until 8 last night. Its director, Abdul Rashid Abdul Samad, said it showed an increase of 15 cases in 3 days compared to 15 cases on January 9. Commenting further, Abdul Rashid said of the total 86 cases involved preschool students 2 years sick, while another 16 were from 1 to 6 students.
The consequences to a society, people and economy. The social and economic implications of influenza cases are in terms of direct cost and indirect cost to patient family and the government. The direct cost charged to the patient are none other than fees due to the cost of treatments, medications, therapy, hospital bills, counseling and the cost of care. The direct cost borne by the government is to allocate expenditure to provide all medical infrastructure and the specialist manpower. Behind the direct cost, there are also indirect costs that involve costs that are subjective in nature. What this means is to bear feeling of shame, exclusions, discriminations, and stigma. All of this has not only reduced the well-being of life, but also become a kind of social cost that must be borne for life by the patient and his families.
Today I want to talk about conclusion. Is there a specific treatment for influenza? In general, there are effective treatment for treating influenza infection where one of treatment option to use antiviral drugs, subject to the result of examination carried out by the treating medical official. Proper treatment is very important to avoid complication of the disease. The best way to prevent influenza infection is to good vaccine annually for individuals 6 months of age and older at most private healthy facilities. Number 2, apart from getting the influenza vaccine, other preventive measures that can be practiced are as follows. Number 1, practice a high level of personal hygiene such as frequent hand washing with soap and water or hand sanitizer. Number 2, practice a good cough etiquette by covering your mouth and nose when coughing or sneezing, either by using a tissue or face mask. Number 3, dispose of tissue or face mask in a cover bin immediately after use. Number 4, keep away from symptomatic individual at least within 1 meter. Number 5, rest at home and avoid visiting crowded place if symptomatic. If you need to go a public place, use a mouth and face mask. Thank you.